Hello viewers of CCR TV. I am Dr. Melvin Silva. I am a psychiatrist in Goa in private practice, and today I have with me my colleague Dr. Doreen.
Yeah, I am also in private practice. I am from South Goa, and both Melvin and myself belong to the St. Luke's Medical Guild. We are here to talk about mental health and to bring about awareness to people, to communities.
Yeah, absolutely, fantastic. It's a wonderful opportunity. We are grateful to CCR TV for this chance to speak to you, the public, directly about what matters to us most, and that's our mind. So, without much ado, let's start straight off, go to the main topic. So, what do we say when we say, what do we mean when we say mental health? Dr. Doreen, what is your take on it?
Mental health, I think, is basically a sense of mental well-being, which encompasses everything, both our emotions, our social well-being, our relationships, our in totality it would mean like combined with our physical health. There's nothing. Physical health is not complete without having our mental health.
Right, yeah. So, thoughts and feelings,
yeah.
That would be very important, isn't it? So, it seems to me that thoughts and feelings have a major role to impact on our well-being, but it could also impact our physical health too. But we don't talk much about it. What do you say? We don't seem to bring it much into the public scenario. Why is that?
I think that's because there is still a taboo surrounding it.
Right.
I mean to say, like we will have cases that come to us very late in the duration of the illness, in the stage of the illness. Mental health means it depicts or it portrays like somebody is weak.
Right.
There's a weakness of the mind.
Right.
So people are not ready to talk about it.
So you would say that people who are strong can also become mentally ill?
Absolutely. Mental illnesses, so mental health issues does not discriminate.
Yeah, so it can happen to anyone.
It can happen to anybody.
Absolutely. Okay. Yeah.
It can happen to anybody.
Yeah.
But people are reluctant to talk about it. I think stigma is still a big factor.
So possibly maybe some of the best among us have already been affected by mental health issues, but we may not talk about it. So we just keep it hidden. Is that how it is?
Most of the time, yes.
Right.
In fact, research and data shows that there are around 300 million people suffering from depression alone in the world today.
Right. Yeah.
And even in the Western countries or the developed countries, less than half of those people will receive treatment.
Amazing.
And much less so in developing countries like us, which is, they say roughly the estimate would be about 10 to 20% of people will actually get help for their mental health problems.
So we are talking about 4/5. So 4 out of 5 people with problems, with the commonest problem, that is depression, would not receive treatment. Either they would not seek help or they would not receive treatment themselves.
Many factors to
Right.
I mean to say, one is that they don't recognize it's an illness, that it's a condition that one can get help.
Right.
You see, they don't realize that depression is actually, up to a certain extent when it reaches, it's a clinical condition.
Okay.
You need to seek help. You need to see counselors. You need to see psychiatrists. You need the assistance of mental health professionals.
Fantastic.
So that's one thing, under recognition.
Right.
Secondly, also other services available.
Okay.
In many places, we are lucky in Goa, like I think there's sufficient strength of mental health professionals in Goa.
Right.
Not so in the rest of India. So
Right.
the accessibility to treatment.
Right. Okay. So there are two sides you're talking about. You mentioned about people not coming forwards sometimes, and the other is the availability of services. Yeah. So is that changing though? I mean, for example, I mean, I've been watching some TV recently where one of India's most famous actresses, Deepika Padukone, spoke about her own depression on national TV. So, is that a sign of the changing times? People may be becoming leaders in the field, becoming more open about their own mental health issues, and in such a way showing society, a light that these problems, depression, anxiety, these can be easily helped, provided you take the right steps.
I think definitely, when celebrities or people in in public life, they speak about their own what you call struggles with mental health issues and can come out in the open, it kind of helps other people to say it's all right, it's okay to talk about my mental health issues, it's okay. Last year, if you will remember, the WHO, the entire campaign for the year was on depression, let's talk.
Right. Oh.
So very important is to talk. Depression. The entire year was dedicated to depression and how it's so important to talk. And how you can get help and you can be helped if you talk about your problem.
And this year it is on youth, is it, or is it youth?
This year is young people and
mental health,
the challenges they face in a changing world.
So what is mental health issues? So when I mean, what do you see when you see someone who has got mental health issues? What's your I mean, somebody walks into your office, what do they do? How do they appear?
Most of the time, I think they are self-referrals.
Right. So they come on their own.
They come
and say, I have got these problems. And what are these problems they're talking about? So they come on their own. They say, we've got these problems.
I think the important thing is that nowadays, at least in Goa, many people know they have to seek professional help. Still, it's kept within the family.
Right.
They're not ready to, to be open about it.
Right.
Even when the situation calls for it, that maybe you have to speak about this to somebody else.
Right.
Fair enough, they want to keep it within the family. The family members realize somebody is sick, somebody needs to see, it's been going on for too long. They realize that, okay, now we've tried everything. They try other ways first, spiritual, or they try things like, a change in environment, some distraction, but then they realize this has been going on for too long. They do come.
Right.
The commonest cases that come are of depression.
So somebody coming and saying, I'm feeling sad, I'm feeling low.
Yes.
Right. Okay. Yeah.
But it's been of long duration.
Okay.
It should be. It's not the sadness or the feeling low which everyone experiences in a day, over a week, up and down feelings. You overcome it. A normal changes in emotions not there.
Right.
It's usually sustained. It lasts for a very long time.
Okay.
It affects your working.
Right.
It affects your relationship.
Right. So something that probably affects a person for a few days to weeks, feeling low for a few days to weeks, or feeling anxious maybe for a few days to weeks, and it's affecting their daily functioning, their ability to work, their ability to take on their roles as family members, etc.
Exactly.
Yeah? Okay.
Yeah.
I was just struck by what you said earlier about that people keep it in the family. And if I may just butt in, one of the things that I know some of the psychiatrists in Goa have also started, but in my own practice, we have a support group. So we have a support group which meets every Saturday, and it's an open group. People just come in, we make a cup of tea, we give out some biscuits, and we just sit and talk. So anyone with a mental health issue is open to come there, and it's a chance to meet with other people, see how they are, and swap notes, make friends, just chill basically, become easy with the fact that these things happen and you can get better out of it. Can people get better though? What do you think?
Definitely. I mean, most mental illnesses are treatable.
Right.
People can get to the level of functioning back again.
Right.
Hold on to jobs.
Okay. So if I were to ask you for an example, someone who has come in to see you, has then improved, Can you walk us through the whole process? What actually happens? Someone who came in maybe for, let's say, depression. Somebody comes in, young woman or young man, in a job, call center job, comes in and says, I'm feeling depressed. Last 1 month, I don't feel like working. Sometimes I feel life is not worth it. I'm losing weight. I'm not getting sleep. What do I do? So, what is?
No, most of the cases, like if it's, I mean to say, if they fit into the clinical criteria for depression.
Right.
If it's moderately severe depression, moderate or severe, mild depression, we try to look for factors that could be contributing to the depressed state.
Right.
If there are triggers, if there are factors which can be modified, or problems that can, there's a solution to it,
Yeah.
we guide the client into handling those issues.
Okay.
If there is a need for medication, yes, the medications are started.
Right.
If they need therapy in addition,
Right.
The doctor will do the therapy or refer to therapists.
Right.
Who,
Okay. So someone
who
like
work-
maybe a counselor,
a
psychologist,
counselor,
a trained
clinic-
counselor.
A trained counselor or clinical psychologist
Yeah,
who can do
yeah.
that.
So is the family
What is
involved?
important? The family is definitely involved.
Yeah.
Definitely involved, because there's a lot that the family can do and understand what's going on with the person.
Yeah.
You see,
Yeah.
and in what way they can support,
Right.
and in what way they can what you call be part of the recovery. So usually the treatment lasts for about 6 months. I think a depressive episode would last about 6 months, and then obviously watch for this thing. Once you decide that you know that medication is no longer required, the person has recovered, has gone back to work, seems to be perfectly well functioning, then we actually ask for just for a follow-up, maybe
Right.
once in a couple of months.
Okay. Yeah, I would agree with that experience of yours. I think that I share that experience. People sometimes, mostly do well with, in mild to moderate kind of situations, they do well with counseling, therapy, talking to them, giving them right advice. Sometimes they need a little bit of medication, and generally for a few months they take it and then they get better. And the family is always supportive, is explain what the illness is about. I do share that experience myself. One of the things that always strikes me as challenging is people often believe that medications are going to be there lifelong. This seems to be one of the things that people think about a lot.
Yeah, that's
So, what are your views on why that is so? Why do people think that way? Is it true that a lot of people would take medication lifelong, or what will be the proportion, for example, of people who you see who probably take it for 6 months, 3 months, and those who take it for longer time?
I think it all differs from case to case. Like
Right.
I
So
think
it's not a major
that,
chunk.
That's a very common, frequently asked question.
Okay.
Is it going to be lifelong?
So it's not
Are
a major
they going
chunk.
to get addicted to it?
Yeah.
I mean, another fear people have is, are we going to get addicted to these
Right.
medications which work on the mind?
Yeah.
Okay. We have to explain how medicines work.
Yeah.
There is no addiction to this medication.
Right. So they're
as such. I mean,
non-addictive. They're not
most of the medications are non-addictive. I mean, barring some few which we monitor. We know.
You're talking about the benzodiazepines.
Benzodiazepines.
So what
we
I
are
call
very
as
careful with the use of those
Right.
drugs.
Yeah.
But most of the other drugs, the majority of the other drugs are not habit forming.
So the
So
treatments
they are
that
worried about habit forming and
Right.
how long they are going to take it.
Right.
I think normally what I tend to do is, like, if a case has recently come, a recently diagnosed case, I myself sometimes don't know how long the illness will go on for.
Okay.
So I go stage by stage.
Right.
Most illnesses are treated for a minimum period of 6 months. Then I tell them, we'll see after 6 months what happens, how much recovery is there. I always advise them that 2 years monitoring is very important after a serious episode.
Okay.
I'm only talking about a serious illness. But milder illnesses where they can manage with, behavior therapies or psychotherapy, or they use other modes, other methods to get well, then of course people are usually left on their own, not on their own, but rather they can manage on their own.
Okay. You spoke about the length of time people take to come to the doctor. My experience in Goa has surprisingly been very positive. I tend to think that Goa has a reasonably well acquainted with the idea of mental health. People are pretty much upfront with it. As far as help seeking is concerned, they would still do the other routes, you know, alternative help seeking, which is absolutely fine. They may go to a healer, or they may go to herbs or Ayurveda or whatever, but they would still also take modern medicine treatment, or modern they will meet modern doctors or psychiatrists. So, generally people seem to be, but that is probably not the case in other states of India, isn't it, where you mentioned there are less professionals.
Services available.
While in Goa being a more westernized, or let us say more cosmopolitan
and smaller also, we are small in size.
Right. Okay. What about, so you spoke about 4 out of 5 people who do not even take help. So, obviously of the population of Goa, let us say we have a population of about 20 lakh people, 15 to 20 lakh people in Goa. You say 20% would have depression somewhere in their lives, 10 to 20%. So, that is about so that is about 1.5 to 2 lakh people in their lifetime.
In their lifetime.
So, if you are talking about 1.5 to 2 lakh people in their lifetime would suffer from depression, this is just depression, we are not talking about anxiety and other thing. So, we are easily saying if we take 4 or 5 houses, in one house there would be somebody with depression.
Yeah, exactly. 20%, if there are 5 members in a household, you would expect one person to have suffered a depressive episode, is currently having an episode of depression, or likely to have one.
But the lay person will say, and I can sense viewers saying this, how come we do not see them? Would you say, can you see people with depression? What do you say?
No, people, I mean, depression is not something that, unless it is a very severe form.
Which is rare, which is not so common. The severe form is not so common.
The severe form, maybe because they seek treatment early, it does not reach the stage where it is severe, but already you can recognize sometimes. I mean, it is not maybe visible on the face, but from behaviors. People will not go around and say, I am feeling depressed.
Right.
Okay. But certain behaviors, like people withdrawing from a group of friends, people not performing up to the normal standards or to the mark.
Okay.
Someone who happens to be slackening.
So, someone who is doing very well in their career or in their work suddenly starts going downhill, does not seem to attend work, or does not seem to be as focused on work
as before.
As before, okay.
I think you would have to suspect that maybe.
Okay. Any other telltale signs? What are the alarm signals for people to note that, okay, this friend of mine is not well, and I may need to have that conversation with him or her?
I think one of the main ones would be withdrawal.
Withdrawing from social occasions?
Yeah. Withdrawing from a normal relationship or interactions that are normally there. Well, that would be one of the, I think that is maybe an early one, but it just shows as a change from an earlier level of a person to what the change is happening now. So, changes, you know, which is not characteristic of that person.
Right. Okay. So, this is depression and anxiety. We have been just talking about depression and anxiety, but there is another larger elephant in the room of mental health, and that is the problem of drug abuse, alcohol abuse and substances. That is a major chunk also, would you say? A lot of people in terms of numbers affected by it?
Alcohol, I think in a general hospital outpatient setting, alcoholism and problems related to alcoholism. It could be like depression in the wife, or children are going through stress. I think they constitute like a huge chunk, somewhere around 30 to 40%.
Oh, really?
I have worked in government hospitals for a very long time.
Okay, you worked in the hospicio for a long time, yes.
And people with alcohol dependence, like they constituted 30, 40, even 50%.
Right.
Not only ones who were dependent on it, but also the family members who were affected by alcoholism,
Right. Okay.
who would
So,
report to psychiatry.
okay. So depression, anxiety, alcohol problems, drug problems coming up nowadays, maybe use of cannabis, use of other drugs like heroin and
It is definitely there. Drug
Yeah.
abuse is there.
right,
Less people come for help.
right,
The few clients I've had, they actually dismiss it as it's like cannabis, for example. It's
Right.
not really a drug.
they say that.
Yeah,
They
it's
say
not
it's
really
not a drug.
not a drug really.
Okay.
It has medicinal value. It has been permitted in certain countries in the world. It's not a drug that way, and they,
Yeah.
you know, they try to say that it's not as what do you would say,
Addictive maybe or
addictive
whatever.
or
Yeah.
serious.
Well,
as
they say
another
they
one.
used to say the same things about cigarettes, and they used to say the same things about alcohol, and we know where that led us. So obviously, addictive drugs are a big problem. Addictive alcohol, cigarettes, nicotine, and other substances are also important. So these are the major chunks that you would see. But what do we as the public? What should the public actually be doing to help themselves so that they don't have to actually go down the route of reaching to a doctor? Is there some way that the public can prevent mental health issues? Like how we prevent, in the old days we prevented smallpox by using immunization. There used to be so much polio. We had all the children with polio affecting their legs, and now we don't see it at all after immunization started. So is there some kind of immunization for mental health, something that would prevent people from getting ill in the first place, keep their mental health positive?
Melvin, as we know, a mental health condition is very complex. There are many factors which are responsible to, ultimately someone developing a mental illness. So to control all these factors does become difficult. But there are mental health promotion, you can promote mental health.
So you can do things
You can
which
do
can protect
things
you.
which can protect you. Like
Right.
there are things called protective factors and the risk factors.
Right.
So if you enhance the protective factors
Right.
in a person,
Right.
in an individual, the chances that that person will develop a mental illness, sometimes even genetically if he is also, predisposed to developing it, is not likely to get it. So promoting mental well-being.
Okay.
Preventive aspects also, and I think all this should start very early, like as early as in schools.
Right. Right.
One of the greatest, one of the difficulties we all have is expressing our feelings. We are taught to do everything else. Identify this is a bird, this is this kind of tree. None of us have been taught to recognize and identify a feeling.
So awareness of the self,
Awareness of the
of
self.
one's own
Yeah.
feelings, thoughts, and
And
mind
if this is
states.
encouraged in school, when someone's not feeling good, talk about it, and open discussions in school. Someone's feeling sad, someone's feeling angry, expression of feelings. I think that does help rather than keep everything,
Right.
contained deep down. Also, education in schools, education about drug abuse, education about alcoholism, addiction. Very early, if it is started, it will definitely help.
I've heard of this thing called mindfulness, where people are taught how to be aware of their own self, their own mind. So becoming more aware of self, and then the ability to express is also important, isn't it? Yeah. So what about being part of a peer group? Being part of a family or a social gathering. Do you not think that will also have a protective effect? For example, if you're part of a church group, a choir group, or maybe you're part of a club. Where
Definitely, definitely. They say the more involvement there is between children and their families as long as possible.
Right.
What happens is by the time children are 13 and 14, they don't want to be associated with the family or the parents.
Okay.
That's part of growing. That's part of them gaining independence.
Right.
And that's the entire goal and purpose of adolescence. But the longer a family is involved with their children, doing things together,
Right.
the more likely is it that they will have better mental health.
So spending time with your friends without the beer,
Without the
spending time with your friends without the cannabis joint.
Yes,
And
yes.
you know, spending quality time with family, friends.
And being part of groups.
Being part of groups, okay.
Yeah, being part of groups,
Okay.
you know,
What
well,
about
it's very healthy. It's
Yeah.
definitely healthy. It's they have to be healthy groups also. You know, the group should have a purpose. You know,
Yeah.
something that the children or the adolescents are taught very early.
Yeah.
A purpose in life. Even part of social groups where they are working towards doing something.
Yeah, so maybe some kind of charitable organization,
Yeah.
something that works with the poor, with you know, different kinds of social causes is definitely
Yeah.
called for. So one of the things that struck me as very positive, especially from the research, is the fact that exercise is not just good for the body, but also good for the mind. And there's a lot of evidence that exercise seems to help in depression and anxiety, etc. Isn't that true? That's
Yeah, it's true.
Yeah,
I mean,
yeah. So let's go to stress. Stress is a big buzzword nowadays. You know,
tell me,
You-
Melvin, how you yourself handle stress. I'm sure.
I know.
I mean, stress is like in today's modern world, everybody. It's a new condition, not condition really, but it's something that everybody goes through with
Yeah.
modern life. How
Abs-
How do you yourself
I-
cope with or manage stress?
I think that's a wonderful question. I think this is so important to all of us. I'm sure coming into this studio, we had this lovely people working in the studio who put us at ease, so they de-stressed us. And I was just thinking, what are the components of what worked to make us feel so much at ease? Of course, they gave us a nice cup of tea. That was the first. So tea will definitely, tea helps me for stress. By the way, I love my tea.
Okay.
You know, you're free to have a cup of tea with me after this, if you're free.
Thank you, Melvin.
Okay. And the other thing that you know, I think talking.
But what do you actually do? Because usually stress is something that lasts for a very long time. It just doesn't go away sometimes. So it may temporarily have a cup of tea, you watch a funny movie, you kind of, you know, for that moment you feel less stressed, but then it's always the underlying, the chronic stress that remains. How do you manage chronic stress?
Yeah, I think in our field especially, there is a lot of stress. In my own experience, I found that at the end of a long day, the stress is there. There's an accumulation of stress. What I have got is probably a lot of good friends, family support. I keep close ties with my family and friends, so that keeps me going. I also you know, have ties with larger groups like social groups like church and other things. And on a personal level, I practice a little bit of mindfulness meditation, what is called as vipassana. So it's a form of observing oneself, and that's also helpful. Some amount of sports here and there. So I think it's a lot. It's a mixed bag, really. So it's a lot of different things, and I imagine it's a lot of different things for different people. But
So you're able to balance your work and your personal life.
Yes,
I think that's
keeping-
very important.
keeping a balance is key. Definitely not to work oneself. Work should not be the only aim of life.
Do you feel you can have a boundary between your work and your? Sometimes do you feel your work goes beyond the boundary once you're home, and then you carry your work home? I mean, being a doctor, it's very hard sometimes. You'll get calls at night. And it's with most doctors in their profession.
Yeah.
How do you draw that boundary when we are also responsible for the care of our patients, and at the same time you should be healthy enough
Yeah.
to be able to take care of patients?
Yeah, I think personally, for me, I feel lucky that I am in this profession. I love to listen to people's stories, and that's how I was drawn into this profession. So one of the things that has helped me is to always remember that somebody who's calling is probably someone who is distressed. So I try to pick up that call with that frame of mind. So there is a concern there. But now if I find that that person has just called me because you know, to say they forgot their prescription and they're coming tomorrow and they're calling me at 10 o'clock in the night, I'm going to say, you should not have called me so late, and I will get a bit sharp with that person and tell him. So I try to, you know, be honest about my feelings.
So it gets really hard now to, you know.
Sometimes
to
it is,
actually
sometimes
does,
it is.
yeah.
Generally I find I give my phone, by the way, my personal phone to my patients, and I've generally found people respect your time. You know, they know that the doctor's time is important for the doctor also, his personal and private life, and they seem to respect that space. I do get a few calls here and there in the night, but that's you know, only in extreme situations. So, I think generally people do respect the time, but if they don't, I tell them you should respect my time.
Okay.
And that
yeah, I think it's important to be firm and you know, to be able to say no, because I think the best care we can give our patients is if we are healthy ourselves, and
absolutely.
Mainly it's we have good mental health
absolutely
ourselves.
Absolutely. I must say this has been an interesting talk. I wonder whether CCRTV will give us another chance to talk like this again. I'm happy to do this again. What do you think?
Yes, of course, Melvin. I mean, yeah, we need to maybe talk on more specific topics.
Right, yeah.
So
this is maybe a start. Maybe if viewers still are interested, we could have more of this in the future. Yeah. Thank you. It's been nice talking to you, Dr. Doreen. Thank you.
Yeah, same here, Melvin.
Thank you.